The state is concerned about finding new approaches, future partners, investment, and professional support. This was evidenced by the high level of representation. Members of Parliament of Ukraine, representatives of the government and the National Security Council of Ukraine, private medical sector entities, and independent analytical centers experts. Ukraine's international partners were represented by the World Health Organization and the USAID agency, which has been helping the country implement reforms for many years. Destruction of the medical infrastructure, mass emigration of doctors, and a drastic increase in the workload of existing hospitals are urgent challenges of wartime. They will become even more acute after victory. Therefore, the state is launching an active dialogue with representatives of the medical industry in order to adjust the directions of healthcare reform. Primarily, it is about creating a transparent system of attracting and distributing financial resources, creating effective mechanisms of public-private partnership, eventually providing Ukrainians with high-quality medical services and reducing the financial burden for them. Investments in healthcare are on the agenda today and during the post-war recovery. We rely on donor funds and the state budget, but we are interested in private investments in the Ukrainian healthcare system. At the same time, we also understand the problems of investing. Everyone we had a dialogue with noted there are business calculations, but the tariffs given by the state through the medical guarantee program are too low for Ukrainian or foreign businesses to work under the medical guarantee program. Even after 4 years of intensive transformations, healthcare will require further profound changes. However, considering the new realities of war and post-war reconstruction, legislative and regulatory changes for the development of public-private partnership and attracting not only charitable aid from donors, but also private Ukrainian and international investments. One of the major tasks of further healthcare reform is the launch of transparent competition between public, municipal, or private hospitals.
I would also like to say on behalf of the Association of Private Medical Institutions in Ukraine that we support healthcare reform in Ukraine, that we support the provision of high-quality medical assistance, introduction of contemporary clinical protocols and standards based on the evidence. We support the development of telemedicine, providing remote services where patients cannot come to us. We also support the e-health system and cancellation of exaggerated bureaucracy. We support the national network of hospitals which ensure all levels of medical health to our citizens. So we are for the patient to choose where he or she is going to go to get medical assistance. We support the statement, but money follows the patient.
Currently, international and Ukrainian investors, partners of Ukrainian post-war reconstruction, are waiting for the emergence of a modernized model of healthcare, but they are ready to take an active part in the development of the Ukrainian healthcare system after the victory.
We have a committee of medical services, and its main priority is to introduce voluntary medical insurance in Ukraine. I would like to note that introduction of this politics of voluntary medical insurance that's going to encourage people to live and invest in Ukraine is one of the 10 priorities for economic restoration of Ukraine after the war, which are developed by the expert companies. And to implement these priorities, we continue cooperate as much as possible with the companies and also with our international partners, and including International Development Finance Corporation, which is American Corporation Finance International Development, which is an establishment of the US, and it also cooperates with the private sector to finance the solutions for the most serious problems that emerge today before the countries that are developing. They invest in all sectors and also in healthcare, especially the private sector. We already have successful examples of cooperation.
Ukrainian legislators are already making the ground for future reforms and transformations. Changes to legislation on taxation, health insurance, public-private partnership. As representatives of the Verkhovna Rada say, now is a unique opportunity to implement the expected changes. These ideas are needed for the reconstruction and modernization of Ukraine, and the government and our international partners are ready to support them. We have already made changes to the legislation. We had one of the few types of voluntary insurance, not only health, which is supposed to be paid by the employer or the individual on the income for some reason, and it could not be charged to expenses. This is to encourage companies, businesses, and even today, co-payment should be considered as a pilot project. Both the minister, I believe, and the government will support it, but we need to find a mechanism that will ensure that every person in this country has equal access to quality medical services. And if a person with a medical guarantee package has been waiting, for example, for 5 months in line for an MRI examination, why can't this service be provided by a private hospital with an extra charge at a night time? This is if we consider the experience of other countries. Today, private healthcare facilities in Ukraine make up about 75% of the entire existing medical infrastructure. Can the private healthcare sector be a powerful partner of the state and help Ukrainians? Sure, but for now, private medicine is almost powerless and is in a discriminated position relative to state institutions. I will give an example of equal conditions for public and private institutions. A nurse who fled from Kherson and whose house was destroyed addressed me. At the same time, some representatives from a bank came to me and said that there are preferential mortgage loans for medical workers. But it turned out that preferential mortgages are only for medical workers of healthcare of state and municipal forms of ownership institutions. Will someone explain? Why a nurse from Kherson, working at the Leleka Center, does not have the right to a mortgage? In February-March, no one asked us whether Leleka was of a private or state ownership. Our maternity center turned into a hospital and was demolished. We were the only one working medical facility in the Bucha, Irpin, Hostomel, and Horenka districts. The state doctor called me and said, "We are all closed. The only thing that I can help you with is to give you the keys to the morgue, if necessary." There are plenty of such examples when both public and private healthcare facilities suffered or were destroyed indiscriminately. Public activists from patient associations and even representatives of state medical institutions themselves admit that Ukrainian public healthcare has huge gaps in the provision of vital medical services that put people's lives at risk.
We can see that in 2022, the situation has worsened with regards to getting free of charge services by patients. Very often, our patients go to private facilities and they get medical services for money, especially when they need a second opinion or it's not possible to get a service in a public facility, and it happens like that. Unfortunately, we are fighting for equal rights for our patients, and also I communicate with lots of managers of many private and public healthcare facility managers with regards to many issues, including those discussed here. And here we have to have the equal access to services, not only on part of patients, but also the providers of healthcare services, healthcare facilities of different forms of ownership.
Similarly, private institutions are expected to be equally powerful players for the quality organization of childbirth and the rescue of newborns.
We have a lot of problems with the state program or guarantees program. If we already calculated what money we have to be profitable, like I know how many children, babies we have to get born in our center. So the tariff is 170,000 hryvnias for the baby less than 1.5 kilos. Seems wonderful, but 60% of those babies stay in our perinatal center for 4, 5, 6 months. If we provide care according to the protocol, 50 or 60% of those babies, they get surfactant, 3 vials, and it costs 70,000 hryvnias today.
150 childbirths now. Even though, 20 years ago, the WHO said that everything less than 500, that's dangerous for the life of a child, a mother and child a year, yes. That was a political decision to actually start from that. What did we get in the end? When everybody left Kharkiv, they went to these hospitals where they used to have 100 childbirths, and they had 100 childbirths per year. In my opinion, for example, with our population number and number of childbirths, it would be ideal if, for example, some private clinic enters, and, for example, if they played honestly this game for normal pregnancy and for normal childbirths.
For Ukrainians, there's no option of choosing whether to go to a public or private healthcare institution. After all, you can use compensation under the medical guarantee program only at the state ones. Monopoly, non-transparent funding, and informal extortion from patients in the public sector have grown the corruption monster that robs Ukraine, its budget, and patients. Everyone is well aware of the informal payments we have in state and municipal healthcare. It is necessary just to make them legal. I have found no analogs in the world where an elected government owns a hospital. And in Ukraine, the regional council is the owner of the regional hospital. In today's situation, the development of private healthcare is impossible. Competition cannot exist in an unclear ownership structure of medical facilities. This is the main problem: an unclear system of financing. The state does not have money for healthcare, but in the shadows, bypassing the state, billions of payments are made. There's this informal sector that robs both the state and the patient.
I believe this is the issue also that needs warrants calculations, and colleagues from financial committee tell us. So we always say that we have to get everything from shadow, but one thing is just talking about that, the other thing is actual calculation. We have to create a competitive atmosphere and circumstances about shadow payments.
We should all be talking not about the way that it's a healthcare reform. What's the most important? It's Ukrainians. What are we going to do? And how is this going to improve their life? How they will start living longer, will be healthier, and what we are all doing to do that?
The implementation of the co-payment mechanism, the development of voluntary medical insurance, and the inclusion of private sector institutions into the system of medical guarantees of the National Healthcare Service are civilized financial mechanisms for the development of Ukrainian healthcare. Competition and transparency will remove the burden of multi-billion-dollar shadow charges in conventionally free of charge state healthcare from Ukrainians. Quality healthcare will become truly accessible to everyone. The private sector needs to do two things. Firstly, at least try to think like a state. Secondly, based on this, try to formulate a business proposal. What exactly do we offer the state? We can say to the state, let's create a normal network of competitive institutions. They will be completely on equal terms with us, and we will enter this network. And there will be normal tariffs, because this network will be nearly 4 times smaller than it is today. Due to this, we will be able to raise tariffs, but we're fully involved in the game and will be ready to cover large costs and attract significant segments of the population, not only in big cities, but we will also go to the smaller ones. Quality healthcare will become available there. One of the main tasks of the reform is the launch of a competitive system. Every Ukrainian will be able to freely choose an institution for receiving medical services among public, municipal, or private, and use payments from state medical guarantees anywhere. The participants of the first large-scale professional dialogue are convinced that Ukrainian healthcare needs immediate reform, taking into account the challenges of wartime and the needs of post-war reconstruction. That is why the Minister of Health called on the public, international donors, investors, and independent analytical centers to launch intensive work on a modernized model of the industry. The participants of the roundtable discussion agreed on concrete steps. On behalf of the professional medical community, a resolution was approved on the need to adjust the reform of the healthcare system of Ukraine, taking into account the unprecedented challenges of wartime. Create a special working group under the Ministry of Health. It will become a permanent professional dialogue platform of interested parties. Merge representatives of relevant state authorities, business, international organizations and donors, leading public associations and analytical centers to coordinate the development of additional effective mechanisms for reforming the healthcare system of Ukraine. Prepare and implement pilot projects in selected cities of Ukraine to evaluate the results of transformations and further spread this experience.